Today I'm going to discuss this interesting topic. Why it's interesting? Because we heard a lot about the dentist rule regarding their patient. However, we don't know our awareness regarding one of the important things in our career and practice, radiation hazard. So my title for today's presentation will be the awareness among dental practitioners to our radiation hazards and protection specifically in Saudi Arabia. Before I start, I would like to move you through my presentation agenda. First of all, we will go through the introduction and background, see our methods and data collection, the data analysis and result discussion, what is the recent knowledge and updates, and I will wrap up with main take-home message. Okay. So as an introductory slides, I would like to say that dental X-ray are one of the most beneficial tools in the modern dental health care. They play a critical role in the process of treatment planning, disease progression management, and the treatment outcomes assessment in the maxillofacial region. So in recent decades, the field of dentistry has witnessed an introduction of what we call cone beam computed tomography, CBCT, which involves a higher exposure dose than conventional radiography. The use of the dental radiography, including conventional radiography along with CBCT in a daily dental practice, in our common practice. So it's well known that X-rays are type of the electromagnetic radiation, which emits energy. Accordingly, they can ionize tissues and they can pass through and from free radicals. So it's different from deterministic effect in that it doesn't have the dose threshold, for example, in a cancer, and on the other hand, the deterministic effect, non-stochastic effect, is the threshold which the severity of the disease increases with the increase of the observed dose above the threshold itself of the radiation dose. Here, I would like to go through our methods and data collection. It's a cross-sectional study. We gathered that data from the different groups of the dental professionals by self-formatted questionnaire was designed and submitted to the research committee. And we gained the informed consent, which include a well questionnaire form that composed of the 4 sections. Which include the demographic data, radiation hazard, protection measures, and the knowledge items. We intended to assess the perception of the participants concerning whether they know if the X-ray are harmful and the most sensitive organ in the item that deliver X-ray to the patients. So in other section, we involve a question that regard the protection measures against the radiation risk. So the inquiries regarding the protection measures such as lead apron and thyroid collars and so forth, all those items are included in these sections. And in other part 4 section, we address how the practitioner update like their knowledge about the radiation hazards. So we ask them, what is the updated knowledge that you gain, recent information, how you are like aware of this major issue. So the survey was distributed among the students of the dental school and the clinician working in the private sectors, along with the governmental hospitals using Google Forms. Okay. So now I'm going to, the result of the data was entered in SPSS software at the version 2020 for the analysis and statistical analysis. Descriptive statistics like, mean and standard deviation, frequency, percentage were computed. With the inferential statistics, chi-square test was used to measure the degree of the association, and if there is an significant differences among the variables of the interest. P-value is less than 0.05 was considered as significant. Okay, so now I'm going to show you, as you can see on my screen, these results section. The results section of all inter-level respondents, according to our studies and GB's level of respondents, was 100%, has less than 10 years experience. Our study illustrates that only 42% of the radiation monitoring devices, such as film respondents, know and follow by the participants. The postgrad student and the postdoctor staff represent 60% and 71% of the respondents, respectively. So our results are in agreement with the previously published studies by Dr. Arnaut and Jeffer et al. And Arnaut et al. And who reported that 67% and 88% and 75% of their participants stated that dental X-ray are harmful, respectively. So our data agreed with the published result by Dr. Bihinjani et al., who reported that 63% of the dental students and dental staff and the dentist claim that dental X-ray are harmful, and contradicted to our studies by stating that approximately 59% of their study samples claim that dental X-ray are not contraindicated in pregnant women. 35% of the postgraduates reported that they either do not use the devices or there is a lack of awareness about them. So to conclude and speak about our result, what's the main highlight or findings? The main findings of this paper actually that while overall extent of the awareness among the dental practitioners toward the radiation hazards and protection measures being followed was found to be satisfactory. There were significant differences in the responses regarding certain aspects, such as the most sensitive organ to the X-ray, whether handheld portable X-ray units were safer than the traditional ones. And their knowledge about handled portable X-rays units. This study result will help practitioners to improve their knowledge and consider the protective measure strictly. This study found that there were significant differences in the responses of the dental practitioner regarding the certain aspects related to the radiation hazard and protection measures followed by them. For example, some practitioner had different opinion about the organ that was most sensitive to the X-ray, whether it's handled or portable X-ray units, safer than the traditional ones. Moreover, there were also differences in their practice related to the radiation protection measures, such as using monitoring devices while taking the X-rays, maintaining a safe distance from the patients during the exposure, and using thyroid collar for the patients themselves. So, despite this variation among the respondents' knowledge and the practice toward the radiation hazard and protective measures being taken during the dental procedure involving X-ray imaging, overall awareness level among the participants was satisfactory, as I mentioned before. The results of ours suggest that further educations on the best practice guidelines could be beneficial for improving safety standards within the field. Overall, This study highlights the importance of the ongoing training programs that aimed to increase the awareness among the dental practitioners toward the potential risk associated with the radiographic imaging technique using in dentistry. So they take appropriate precautions when performing these procedures on their patients. Okay. Now I'm going to our discussion part. Although the impact of the dental x-rays on the patients and the practitioners are considered minimal and must be not ignored. Generally, the dental clinician need adequate training and updates in relation to the radiation hazards and the protection guidelines that they must be followed. If we talk about radiation hazards, through the literature review, we find 3 studies assessing the knowledge and attitudes of the dental practitioner toward the radiation hazard and protection. Our participants were questioned whether the children are more sensitive to radiation. All of the dental practitioners agreed that children are more sensitive to radiation. Like our results are also agreements with the studies and the data reported by Dr. Rainey et al. However, Dr. Srivastava et al. Contradict our results by stating that approximately 59% of their study sample claimed that the dental x-rays are not contraindicated in the pregnant women. So as a summary of our discussion section, is about the importance of the training of the dental practitioner on the radiation hazards and the protection guidelines when we're taking an x-ray. As even though the impact of it's minimal, so it should be not ignored again. The study need to be questionnaire and to assess the awareness among the dental practitioner on protection measures and as keep distance from the patient and using those tools. The studies found that there is a room for improvement in awareness and implementation of these protection measures among the dental practitioner. Also, we focused on the importance of the training again. We emphasized that even though the impact is little, but it should be not ignored. Self-structured questionnaire is a good thing to assess something generalized like awareness among dental students. And yes, there is area for improvement regarding their awareness and their practice, especially if they're taking the crucial and important precautions. Okay. The last part of this survey addressed the best approach to receiving the updated knowledge about the radiation hazard and protection. We note that the most participants prefer like continuous education courses, courses, and self-study through the internet. Our data are agreement with the results reported by Dr. Mitwani et al. So as you can see, they prefer to continuous education to get more updates regarding their career, since we all know that dentistry is an ongoing process of learning and not stop at book or some specific articles. So continuous education is important things, like attending such conferences is one of the best things to get learned. As a conclusion, I would like to say that generally dental clinicians need to have this important attitude and awareness regarding their practice. The impact of the dental x-rays on the patient and the practitioner are considered minimal. It must be adequate training and updates in radiation hazard and the protection guidelines they must be followed in each clinic and hospitals. Our results are in agreement with the previously published studies. On the most participants stated that dental x-ray are harmful, and our data agreed with the published studies that mentioned that 63% of the dental students and the dental staff claim that they agree on the same specific area of the harmness. Yes, some of the study, our data show that all the participants agreed that the dental X-ray might be harmful on the pregnant women. Studies are reported by many clinicians are on the same page of ours. I would like to take more time than this. Here is my social media. If you want any contact or collaboration, you are more than welcome. Thank you again. And if you have any question, you are more than welcome.